with type 2 diabetes are the cousin diseases, I call them. High cholesterol, high blood pressure.
Diabetic complications.
Yes. What are these medicines right here?
These are for the boxes are for the insulin that I quit taking. And I have metformin, then I have for high blood pressure, then I have some Crestor for cholesterol. But I don't have to take any of this anymore. All of it's gone. This is all the medicine that
you
I
were
used to
taking
take.
all that before and weren't feeling any better. That's the key.
Wasn't feeling any better.
All right, so Dr. Reddy, I think a lot of us believe that if we take the medicine, we'll feel better and we can stop the complications of diabetes.
Correct. That is the myth, saying that if you take medications, you can stop the complications. But what happened? He has been taking the medications, he's been gaining weight, he's been feeling miserable, and he continues to take the medication, and he's stuck in a cycle, and he's like a hamster on a wheel, can't get out.
I have run into so many people who said either they've tried your diet and they're like, look at me, I feel great and I've lost a lot of weight. Others who say, you can't be serious that just a diet can get rid of type 2 diabetes.
Here's the example. Tell us what happened.
Well, the incredible thing about it is I learned what not to put in my body.
Yeah.
And once you learn what not to put in your body and what causes all this, that's what did it.
Yeah, he heard about your program.
That's right.
And then he decided he would follow it to the T. You have that program outlined in your book, Eat This, Lose That.
It's also in Spanish.
Okay. And then, but the problem is that a lot of us think we know what to eat and what not to eat.
Correct. But before what happened, listen to this. He is not even my patient. He just heard me on the radio. He decided to come in. He spent 6 hours in the office because I was doing the study. So he enrolled in the study. He spent 6 hours in the office, learned everything about diet, and then he went on the bread, the ready bread, and the recipes in the diet. He stuck to it for how many weeks? 8 weeks.
8 weeks.
And then what happened? In 8 weeks, he's off all his medications. And he lost close to, actually, he lost 38 pounds. And look at the waist.
Can I show you?
Yeah, show me those pants.
These are the pants that I used to wear. And now, look at me now.
Look at you now. Look at you now. You don't normally wear like tights around, but you did that today to show us just how much.
I did that to show you today. How much I lost.
That is incredible. Okay, people will always say, okay, I know I'm supposed to eat better, but you're going to tell us just some of the things specifically. Like, for example, for a breakfast, for example, what should we do?
Let's ask him, what do you eat for breakfast?
Breakfast, I had 3 overnight eggs, 2 pieces of sausage patty and some ready bread. And
you could have a sausage patty in there?
Sure,
See, I think we assume that we have to starve ourselves.
Sure, no. You can eat any type of meat you want to on this diet.
Okay, and then like for lunch?
For lunch, I had a salad, and I took a slice of ready bread, cut it up, and put it into my salad, and just had salad and 2 glasses of water.
Yeah, he mentioned ready bread. What does ready bread do?
See, ready bread is made of soy and flax, and basically it's a very, very low glycemic food, and every patient who has eaten that bread has dropped their blood sugars to normal if they are on my diet, and they also lost weight, because this bread is very low in carbs and does not raise your blood sugar.
But makes you feel like you're having some carbs.
Yes, and it actually fills you up. How does it feel?
It makes you feel very good, very good. Once you eat the bread, you can, and work with it daily, then you can feel your body accepting it, and it's great for you.
Yeah, what about dinner?
For dinner, I had 2 pieces of meat, any type of meat.
Yeah.
Sometimes I have steak, sometimes I have chicken, sometimes I have different other kind of meats. But you can have any type of meat, along with 2 glasses of water, a small salad, and ready bread.
What made this diet different than what you had been doing before?
Well, I had to give up a lot of stuff because I like potato chips. I like to eat all this other stuff. In taking my insulin, I could eat anything I want to. Then take the insulin, I thought I was feeling better. But at the same time, that was keeping me with my sickness.
Plus, it was also affecting his eyes. And so what happened to your vision?
Well, since I had diabetes, I lost this eye. But since I've been on the Ready diet, I'm beginning to get a little bit of shadows of visions out of this eye.
Wow.
Which was not possible before. He couldn't see anything from the vision from that eye.
And
but
if
now,
he had kept on going, he would have been blind.
Other eye also. But on the contrary, his vision on the other eye improved, and he's now actually, with his eye closed, left eye closed, he actually sees shadows.
Right.
Which is a significant improvement for someone who could not see anything from the eye.
Yeah, and again, thinking that the medicines would slow down the diabetes and the impact of diabetes, which could be blindness, kidney disease.
But he was on the medications.
Yeah.
But he was taking the medications. He was continuing to progress to have all the complications.
Okay, so the evil foods here, it sounds like, are starch and sugars. And it's still hard for a lot of us to believe that just by changing your diet, something that you can do yourself, doesn't involve taking any drugs, doesn't involve really going to a doctor's office, that you can make that kind of difference and get rid of your type 2 diabetes.
But the secret for success for him was he accepted coming to the office, spending 6 hours learning everything about food and what not to eat. That's what helped him. Even though he's not my patient, because he was in the study, he went on the program, but he stuck to the program, but he had to understand what to eat and what not to eat. And that 6 hours of training is what changed his life. Now look at that. He's not on medications. He lost weight. He says, I feel like a 20-year-old. That's exactly what he said. He's 64 years
Deborah,
young.
I'm 64 years old.
Look at you.
And I feel like I'm 20.
Yeah. So you wish you had known about this 14 years ago. No, but I have to ask you, would you have been ready to do this 14 years ago?
I would try anything, you know, not 14 years ago.
Yeah.
But after shooting yourself with a needle in the morning and the afternoon for years, you try anything to try to get off of it.
Yeah.
But I was always told that once you have diabetes, you always have diabetes. That's not true.
Type 2.
You actually can get off of your medications.
His doctor called him and said, hey, how come you're not coming up? What happened? We need to do all the tests. So he said, I'm doing fine. So he goes to his doctor's office and finally gets all the lab work done. What did the doctor say?
The doctor goes through the lab work with the doctor. He come back and he says, you don't have anything. Tell me, what did you do? I said, Dr. Reddy. He said, oh.
Well, you heard Keith say he wished he had known about the diet sooner. Dr. Reddy holds diabetes workshops to answer all of your questions. You can also hear from other people like Keith who can say, look, I was once lost, now I'm found. The next one is on May 19th, or you can schedule an appointment with Dr. Reddy. Call this number right here. It is 281-491-0044, 281-491-0044, or find him online at reddycardiology.com. You can also catch Dr. Reddy on his weekly radio show. Go to our website for more information on that. Congratulations to your new life.
Welcome.
Thank you, Dr. Reddy.